Hi, so here we are in Odisha, and many of you have been asking about what the situation is here. So we are in the second wave. It's just hitting us right now. You've seen the devastation it's causing in Delhi and Mumbai and some of the other big cities. Nearly 400,000 cases were recorded yesterday, and that's just the recorded ones. That's not the ones that aren't getting to hospital in time. So it's absolutely devastating here at the moment.
We would anticipate that we are about 2 weeks behind Delhi, and the second wave is just starting to hit us now. And having seen the footage of that's happening around the nation, our hearts are broken. That's simply all we can say. We do know that because we live in one of the poorest states of India, there are so many more obstacles in getting healthcare and so many more obstacles in keeping themselves safe. Last year we covered the first wave pandemic. There was a national lockdown and we had to do a food distribution program. At the moment there isn't a lockdown on daily wage workers, and so people are still eating, but of course that means everybody is still gathering. So we're going to show you in this video what it takes actually to be able to even get reported to be COVID positive. I've just literally come back from seeing one of our patients, so here's his story. So Joe and I are just going to go out. We've had a call from one of our children who comes to the Children's Therapy Centre who has Down syndrome. We are going to go. He has got some symptoms of COVID that we're worried about. So I'm double masked up. Our nurse and driver will be in PPE, and Joe is going to take us on a bike. And let's see what we can see around here. So Joe and I are on the motorbike and we're coming up the main highway into the city centre of Berhampur. It's a 44-degree heat index, and so we are really grateful for the cloud cover. As you can see, it's quite quiet on the roads at the moment with curfews in place. As we drive along, we're coming up, we found somebody there has sourced an oxygen cylinder and carrying it on their scooty. Now we're just trying to find out where our little patient is living. And here we go. Here is his mum, Seema. She seems to be coughing. Okay, here we go. I've not been to your house, Seema. Hi, namaste. Hi, Shamik. Hi, buddy. Shamika is 6 years old and he comes along to our Children's Therapy Centre. We first met Seema when she felt in a really difficult situation. Shamik has Down syndrome and is a gorgeous boy, but Seema's been through a lot of really bad stuff in her life because she had a childhood disability. Seema's a single mom with her son, and you can imagine how difficult it is when you start coughing here, you've got no access to transport, and you've got a child with special needs, how scared you are. So we've actually asked our friend Kailash to come in, who does private blood tests. This is so that we can shield Shamik and he doesn't have to wait for an hour or two in a very crowded diagnostic centre for his bloods. From taking his history, it's very likely he has COVID, so I'm waiting for my PPE. So Seema and then Shamik are having their rapid COVID antigen test done right now. So we've just done an antigen test. This is our testing line. We have to wait 5 minutes, but we've got a faint positive line coming for COVID. So we're going to finish his blood test, make sure he hasn't got typhoid, anything else on it, and then we're going to go and try and get this PCR test for him. So that's not so good. Okay, let's get on with the bloods. Paying for blood tests and interpreting the results is just one way we can help all our families. Okay, so just putting on the PPE, 44-degree heat. Now Seema's had an awful cough for the last 5 days with a fever. Her mum's had a cough. Shamik's been off his food for 3 days with a fever and a cough. Auntie in the same compound where they live is positive for COVID. Uncle is positive for COVID. Seema's obviously really worried. She's tried her best to shield, but in the population of India it gets really difficult. How are you, darling? Where's Mary auntie? Do I look like snowman? Oh my goodness, look at your mouth. So good mouth. Give me a high five. Yeah. So I've already actually done a full examination before the video. Their oxygen levels are good at the moment. Seema's got quite a fast heart rate. But Shamika's looking pretty stable and steady. So we're going to go over now to one of the testing centres. It's really unknown whether we can get a PCR test, but that's our gold standard. Without a positive PCR test, you're not being allowed to admit to any hospital, even if there was a bed available. So that's one of the ways that the poor of Odisha are not even getting into the hospital. So that's where Love the One comes in. We come and advocate and get them the tests that they need. Let's go then. Mummy's coming too. Come on then, Mummy. Mummy's also been coughing. And I'm just going to disinfect before we get in the car.
So it does create some fear where they see us in the community in our PPE, but it also is really good awareness for people to really take this virus seriously. We are incredibly grateful that we now have a life support ambulance for critical patients, and we also have 3 more jeeps both here and at the rural base, so that we can be transporting people around the city and the rural areas to get to medical care fast. So we're now just approaching one of our partner hospitals in the city, and we're going to turn in and hope that we are in time to get a PCR test and that the day's quota hasn't run out today.
And we're going to try and keep Shamik, because he has Down syndrome, inside our vehicle until we can get him out, because I don't want him in a crowded room. Now the problem with accessing tests and injuries, people don't know, they think a swab for an antigen is the same as a PCR. So that's one major thing of awareness that we're getting out, is that a negative antigen test does not mean it's negative for COVID. You need to know the medical science behind it, and that's where Love the One advocacy really helps and where we can spread awareness. They're going to gown up now because they know we've got a positive case in our Jeep. So that's really good. This is one of our partner hospitals. And we're just really grateful that they're here because they work closely alongside us in the community.
So this is where we leave Shamik and his story. We await the news of his PCR tests, and he's in home isolation being monitored 4 times a day by Love the One so that he remains stable.
People are scared. People are exhausted. People feel depleted. People are apathetic. One of the important things that Love the One is talking about prevention, talking about isolation, talking about masks, talking about hand washing and keeping a distance. But it's also going out day after day after day to those who are getting sick in our communities. They're phoning our clinic, we're donning PPE and we're going to them. And we're taking them in our vehicles and we're going to ask for the PCR tests. We are phoning around hospitals who's got beds available ready. We are in the process of setting up isolation centres for those who can't isolate because they live in crowded conditions. We are in the process of trying to obtain oxygen concentrators for a crisis. If somebody comes to us gasping for breath and the hospitals are full, what do I say? And you know, I've just come back now and we've just had our very first positive amongst our special needs community here. Shamika is 6 years old. We've known him since a toddler. We've known his mom. You know, we've just shown you their story. And to see the line come up saying that they're positive for COVID, you have to act as a professional in it. But when I come back home, I know that I've got to now disinfect so I don't pass it on to my children. But what about Seema and Shamika? If we weren't here, they would have stayed in their house and maybe just deteriorated. Let's hope that the fact that we know them and they trust us to care for them, that we can keep them safe even though they're COVID positive. Over the next 2 weeks, we are going to be going up that curve very fast. We don't know how long this is going to last for, but we are as prepared as we can be. People say, how can I help? And it's a really difficult answer because I can't magically produce ICU beds. I can't magically produce all the PCR tests. I can't produce the health system and the structure and the infrastructure that we need. Those of you who donate to us, every penny is going towards what we're going to do. PPE for every single patient when we go out, hand wash, giving out provisions to people, everything costs money, the fuel in taking people. If we get more and more positive cases, we may need to pay for private ICU beds. That's going to cost a lot of money. So how can you help us? You can pray for India, you can encourage our team, and all we can say is from this end, we are on the edge of the biggest crisis that we've ever known in our time in India, in our working lives. And we don't know what's ahead, but we're glad we're on the ground. We're glad we're here. People feel like, don't you want to come back to England? No, this is our family. These are our communities, and we stand with them. we've had the privilege as health workers being vaccinated. We are able to go and serve and help in any way we can with our team. And so we're proud to be here, but we're also pretty scared and heartbroken at what we're seeing. Thank you for being with us. Thank you for just being on the other end of Facebook or Instagram and just cheering us on. And we will keep you posted as we go through this crisis.